Although health and safety regulations for the caring professions are similar across European countries, there are clear differences between member states in the establishment and implementation of these regulations. Trade unions and employer organizations play a key role in this process, as well as dedicated health and safety control mechanisms at the level of specific workplaces. As a result, care workers in some countries may enjoy better health and safety conditions than in others.
In all countries, a legal regulation is the backbone of health and safety work, while collective bargaining plays a rather minor role. Still, there are some institutional differences. First, there are differences in terms of what is covered by law. One such main difference is whether psychosocial risks are included in the legal regulation or not. Second, difference in the standing of social partners at national and sectoral level affect whether they can provide supporting structures for the local level. For instance, information to local representatives, guidelines and recommendations to employers. Third, at local level, there are differences relating to the election and the standing of employee representatives. This creates variation in the extent and effectiveness of such local representation. But it also affects whether higher level social partners, employer associations and trade unions receive information of what goes on at local level and get the possibility to take action on the local level health and safety conditions.
In addition to the processes of establishing health and safety regulations, compliance is also important. Effective execution in practice is crucial for the working conditions of care workers.
Solid preconditions for dignified, safe and healthy workplaces are created by law, which is detailed. Still today, employees' rights are respected only when enforcement is combined with knowledge, skills, sufficient resources, shared responsibilities and dialogue built on trust. Else, legal requirements remain on paper and nobody cares whether workloads doubles or triples, whether working week becomes 80 hours or whether employee quits the job. Employee does not become safer when all the equipment is present, but he or she does not have time to use it or skills to use it, whether managers choose to pay fines and keep on breaching employees' rights. Patients are safe when employees are safe. That is best practice when state is ready to share and social partners are ready to simultaneously contribute to the law enforcement in different ways.
This is particularly relevant for care workers exposed to multiple risks of biological, chemical or psychological nature. In the HEROES study reports, you can read more about the impact of legal and institutional solutions on working conditions in the care sector.